Caring for your kidneys. The kidneys are vital organs that do a lot of work in the body. The kidneys remove waste and excess fluid from the body in the urine. The kidneys work closely with the heart to keep blood pressure in a healthy range. Chronic kidney disease, or CKD, is a condition where the kidneys don't work as well as they should. In medical terms, chronic doesn't mean serious or dangerous. It actually means a condition that lasts a long time. So, people with chronic kidney disease need regular health checks and usually take medication over a long period of time, usually for the rest of their lives. Chronic kidney disease is common. It affects around 1 in 10 people around the world. High blood pressure and high blood sugar levels, which mainly affects people living with diabetes, are the most common causes of CKD. High blood pressure and high blood sugar levels damage blood vessels all through the body, including blood vessels in the kidneys and the heart. The kidneys and the heart work closely together, so healthy kidneys help keep your heart healthy. For people with diabetes, good diabetes control helps keep your heart and kidneys healthy. There are 5 stages of CKD. These stages are a way for us to measure how well your kidneys are working. Moving from one stage to another does not usually cause sudden changes in symptoms. CKD stages help us to monitor your kidney function over time and are not connected to other illnesses like cancer, heart failure, or lung disease. A blood test called GFR shows how well the kidneys are working. The GFR number tells us the stage of CKD a person has. As kidney disease gets worse, the GFR number goes down. Stage 1 and 2 CKD means mild kidney damage. In stage 1 CKD, the kidneys are working between 90 and 100% of maximum. The GFR number will be 90 or higher. In stage 2 CKD, the kidneys are working between 60 and 89% of maximum. GFR will be between 60 and 89. Stage 3 CKD means moderate kidney damage. The kidneys are working between 30 and 59% of maximum. Stage 4 and 5 mean advanced kidney disease, when the kidneys are close to stopping or have stopped working. Most people don't have symptoms in the early stages of CKD. Symptoms of kidney disease usually start in stage 4 and include sickness, tiredness, shortness of breath, and muscle cramps. In stage 4 CKD, the kidneys are only working between 15 and 29% of maximum. GFR will be between 15 and 29. Stage 5 CKD means that the kidneys are working less than 15% of maximum and may stop working. GFR will be less than 15. Kidney failure is when the kidneys stop working. People with kidney failure get help to choose between a kidney transplant, dialysis, or supportive care. Most people with CKD do not reach advanced kidney disease or kidney failure. Urine albumin to creatinine ratio, or ACR, is a urine test that tells us how much of a protein called albumin is in the urine. The ACR urine test helps spot kidney disease. A small rise in ACR can be an early sign of kidney problems. A very high ACR means the kidneys may be more badly damaged. It is important to measure GFR and ACR regularly to check how well the kidneys are working. The number of people with CKD is growing. One reason for this is that the population is getting older. The kidneys don't work as well as we get older. Also, as more people have high blood pressure and diabetes, the kidneys are more likely to become damaged. There is no cure for CKD, but there are ways to keep the kidneys healthy, stop kidney failure, and stop serious heart problems for many people. It is important to spot CKD early, live a healthy lifestyle, have regular kidney health checks, and take medications that protect the kidneys and the heart. Healthy living means eating a healthy, balanced diet, being active, and stopping smoking or using tobacco if you currently do. Following a healthy lifestyle is important for us all. It is important that people with CKD have regular kidney health checks. CKD is spotted with quick and easy GFR blood tests and ACR urine tests, usually by a health professional in the GP surgery. Blood pressure checks are also part of a kidney health check. These checks are done regularly to check your health and to check how well the kidneys are working. If you have diabetes, it is important to have regular diabetes checkups. A kidney health check is actually an important part of diabetes care. Some medications help your kidneys and heart stay healthy for longer. Your pharmacist can help you understand these medicines. Ramipril and other medication ending in pril treat high blood pressure, reduce the amount of protein in the urine, and protect the heart. Candesartan and other medication ending in sartan do a similar job to medication ending in pril. Canagliflozin, dapagliflozin, empagliflozin, and other medications ending in flozin increase the amount of sugar and salt that leaves the body in the urine. This eases the strain on the kidneys and the heart. Pril, sartan, and flozin medication help keep the kidneys and heart working better for longer, lowering the risk of kidney failure and helping people to live longer, healthier lives. Medication ending in statin, like atorvastatin and simvastatin, lower the levels of LDL, or bad cholesterol, in the blood. High levels of LDL cholesterol increase the risk of cardiovascular disease. Heart attacks and strokes are two types of cardiovascular disease. People with chronic kidney disease are usually offered a statin because they are more likely to have cardiovascular disease than people who do not have CKD. Other medication may be offered to people with CKD. For example, other types of blood pressure medication. Medications that help lower the risk of heart attacks and strokes and serious kidney problems. And diuretics, sometimes called water tablets, to help reduce blood pressure and to stop too much fluid building up in the body. If you have diabetes, it is important to take your diabetes medication as advised by your health professional. Some medication can seriously damage the kidneys. For example, anti-inflammatory painkillers like ibuprofen or naproxen that can be bought from a pharmacy or a shop. Some herbal remedies can also harm the kidneys. It's important that any medication you buy online is approved by a health professional to make sure it's suitable for you. If you have CKD, speak to your pharmacist, doctor, or other health professional before buying any medicine or herbal remedy over the counter or online. Your health professional may ask you to stop some medications if you become unwell, for example, with diarrhea, vomiting, or a fever. This is sometimes called sick day rules. Stopping or pausing some medications while you are unwell gives the kidneys time to rest until you are better. This lowers the risk of kidney damage. You may be asked to stop pril, sartan, and flozin medication, and also water tablets, and medication for type 2 diabetes. It is important to start taking these medications again when you are well, usually after 1 or 2 days of eating and drinking normally. You should stop anti-inflammatory painkillers like ibuprofen and naproxen if you become unwell. It may not be safe to start anti-inflammatory painkillers again, even when you are well. Your pharmacist, GP, nurse, or kidney specialist, if you see one, can give you more information about sick day rules. Most people with CKD can keep well by living a healthy lifestyle, having regular kidney health checks, and taking the right medication. If kidney disease gets worse, or if symptoms of CKD start, kidney specialists will be asked to help. The kidney specialists will talk to you about kidney disease and do more kidney health checks. New medication may start, doses may change, and some medication may stop. So remember, the kidneys are important organs that remove waste and excess fluid from the body in the urine. The kidneys work closely with the heart to keep blood pressure in a healthy range. Chronic kidney disease affects around 1 in 10 people around the world. Spotting CKD early, living a healthy lifestyle, having regular kidney health checks, and taking the right medication can stop kidney disease from getting worse and stop serious heart problems. If you want to learn more about CKD, speak to your doctor, pharmacist, nurse, or kidney specialist.